Little Miss Sunshine.
Dwayne Hoover, a sullen 15-year-old boy trapped in a family ridden with depression, narcissism, and substance abuse, dreams of becoming a pilot for the U.S. Air Force. Dwayne is a firm believer in the teachings of German philosopher Friedrich N., who argues that the purpose of one's life is found in one's own will to live. This belief leads Dwayne to remain silent until his goal of becoming a U.S. Air Force pilot is accomplished.
Dwayne Hoover suffers from schizoid disorder, which belongs to a group of eccentric personality disorders. Dwayne's disorder is a result of both environmental and biological factors related to the environment in which he was raised. Symptoms of this disorder include lack of desire for companionship, expressing indifference, and choosing to remain solitary at almost all times. Common stigmas associated with schizoid personality disorder include being depressed, hateful, cold-hearted, and crazy.
Evidence proving Dwayne's diagnosis lies in the lack of willingness to speak and the overt hatred he has toward his family. One symptom of schizoid disorder that Dwayne's character doesn't reflect is the inability to pick up normal social cues simply because he chooses not to express it.
Treatment that would be of most benefit to coping with Dwayne's schizoid disorder would be visiting a therapist on a regular basis and taking antidepressants or anxiety medication. Therapy would provide a patient with schizoid disorder with a place to express repressed emotions and feelings, and anti-anxiety medication would allow the patient to cope with the stresses of being surrounded by people. Ethical concerns involved with this treatment could include taking medication to treat his disorder due to the chance of mood swings or potential personality changes. A situational barrier that is strongly reflected in Dwayne's character is the idea of not speaking and being in denial of the reality around him, which may hinder this character from receiving the proper treatment in the future.
Little Miss Sunshine accurately portrays Dwayne as possessing the most prevalent symptoms of schizoid personality disorder. As mentioned previously, Dwayne does not desire or enjoy close relationships with family or friends. He is detached and indifferent, and chooses to be solitary whenever possible. Films such as this one shed light on the difficulties of struggling with disorders such as this one and provide the general public with better understanding of various disorders.